Do you know about hydrophobia? A dreadful consequences of rabies. Hydrophobia, or fear of water, is not just psychological. It's a terrifying symptom in the final stages of rabies. The patient experiences intolerable thirst, but fears to drink water. How does this happen? Let's see in this video. The word rabies comes from a Latin word rabidus, which means mad. Humans get rabies by the bite of rabid dogs, raccoons, or other animals carrying rabies virus in their saliva. The virus gets deposited in the bite area and penetrates inside the body through the wound. The virus multiply in muscles, connective tissues, and nerves at site of injury for first 48 hours. As the virus enters the nervous tissues, it begins to ascend upwards to the spinal cord and brain. The virus moves slowly. It's only about 3 millimeters per hour. This is the reason why bite on the face and head region is more dangerous. The virus needs shorter time to reach the brain from face and head. Once the virus reaches brain, it spreads along nerve trunks to various parts and affect the nerve signal transmission. So what type of symptoms appear in rabies? The symptoms can be divided into 4 phases. The first phase is prodrome phase. Symptoms like fear, anxiety, restlessness, irritability, and nervousness are seen. Inability to sleep or insomnia and depression characterize this prodromal phase. These symptoms last for 2 to 4 days. After this is the phase of encephalitis. This is where the patient exhibits hydrophobia. The person feels intense thirst but cannot drink water. He or she can take solid foods but not liquids. This is seen because attempt to drink bring on such painful spasms of pharynx and larynx, producing choking and vomiting reflex. Due to this, patient develop a fear of even sight of sound of water. This is known as hydrophobia. Generalized convulsions are seen where there are involuntary jerking movements and seizures. After this phase, patients may reach to unconscious state known as coma. Coma is followed by death, which occurs within 1 to 6 days due to respiratory arrest during convulsions. For rabies, vaccine only work before symptoms appear. For this, post-exposure prophylaxis can be given. However, there is no use of vaccine once symptoms appear. There is 100% chance of death once symptoms appear, and death usually occurs within 1 to 6 days following the appearance of symptoms. So the best way of prevention of rabies is protecting ourselves from bites of rabid dogs, raccoons, and other suspected animals. It's more wise to get your pets vaccinated against rabies virus. Once symptoms begin to appear, it's the invitation for death. Thank you for watching. Please like, comment, and subscribe this channel for more contents like this.